Assalamu alaikum. Today I am going to teach you how to examine a patient in primary care. Before I teach you the systemic examinations, it is very important that you should be aware of the general principles of examination. First of all, you need to maintain the privacy of the patient. Be very sure that you can close the door before examining the patient. Ask the patient if he or she wants the attendants to be inside the room while you are examining the patient. If you are of the opposite gender than the patient, you should have a chaperone with you. If you have a nurse who can be with you, or you can keep an attendant in the room while you are examining the patient. The lighting should be appropriate so that you do not miss anything while you are inspecting different systems of the patient. Introduce yourself before you examine the patient. If you're a student or a trainee and your supervisor or your mentor has asked you to examine the patient, always introduce yourself and seek permission from the patient if he would be okay with being examined by you. Expose the patient appropriately. Always uncover the body part which you are examining only. Do not unnecessarily expose the patient, and always help the patient cover up or offer your help at least. After that, you need to be sure that you are approaching the patient from the right side. So the bed of the examination bed should be placed in a way so that you can examine the patient from the right side. Always sanitize your hand before and after examining the patient. First of all, you need to take the vitals of the patient. So before going for any systemic examination, neurological examination, a chest examination, a CVS examination, or an abdominal examination, first you need to take the vitals of the patient. A vital assessment includes height, weight, blood pressure, a pulse, and if you have a pulse oximeter, then you can also check the oxygen saturation of the patient. After you've done with your examination, thank the patient, and as I already mentioned, sanitize your hands.